Hi, friends. Good evening. This is Dr. Chetna Jain, and today we are going to talk on a very hot topic, and that is COVID vaccination during pregnancy and lactation. COVID has been here since March 2020, and it's more than 1 year. That all approximately 15 months that we are dealing with this disease, and still a lot more is to be known. But by this time, we know a lot. So first of all, let's come about what is COVID vaccine and how does it protect you. So COVID vaccine is a killed virus vaccine. It's not a live virus vaccine. And once it is injected into the body, the body reacts to it and makes some antibodies. And these antibodies, they circulate through blood all over your body. So whenever the actual virus attacks you, these antibodies will go to the point where the virus is there and will try to neutralize the virus. And that's how they protect you from the disease. So this is what is the role of antibodies in prevention of any infection, and the COVID is also the same. So like any viral, now the problem with COVID is it's a viral infection, and like any other viruses in the world, it also doesn't have any kind of antiviral antibiotics, the ones we use for bacterial infections. Like if somewhere having pus or something, we are typically sore throat, urine infection, chest infection. But unfortunately, for virus, there is no antibiotic. We don't know whether it was used as a biological weapon or it was an accident, but we know it well that it's all over the world. There's no country which was immune to this virus. Some have eliminated it, but still nobody. It's went to all the countries in the world, and that is thanks to the travelers from one country to another that it traveled. Otherwise, it would stay located into the China only, and it wouldn't have come out. Anyhow, now that we are dealing with the disease, we need to know more. And whatever we know based on that, as of today, we talk. So now this is end of May, beginning of June 2021, and based on the knowledge today. About last month, there was a lot of controversy about whether pregnant women can take vaccine, whether lactating women can take vaccine. Now, over the months, it has gotten clear that lactating women can safely take vaccine, and thankfully, last month, in the month of May, Government of India announced that it will give vaccine to all its lactating women. So these women are also eligible. So we should understand that each one of us need vaccination, be it pregnant, be it children, or lactating, menstruating, somebody who's not mentally well, and so on. So who cannot take the vaccine is primarily those who are allergic to the components of the vaccine. So only those should be excluded, or those who are so immunocompromised that possibly even after vaccination, they would not be making antibodies. And if their practitioners say that, these people should not be taking, so only those people are excluded. So why in the world we decided that pregnant women should not be taking vaccine. So now we are reverting on that, and we believe that pregnant women should also be taking vaccine. Now, pregnant women constitute about 5% of total Indian population. So if we don't give vaccine to pregnant, that means we are depriving these 5% and another 5% which is inside their tummy. So total about 10% of the population, or about 8-9% of the population, will be deprived of the vaccine. Now, the second question is whether pregnant women currently can take vaccine. Now, I made my stand clear that government has allowed, so now lactating can all go, they book their numbers and take vaccine, provided they are above 18 years of age. Women who have delivered below 18 years of age still are not eligible for vaccination because they will be considered into the category of children. So in urban population, we don't see those kind of children, those kind of women who are below 18 and delivering, and that's why we fail to touch those topics. So for us, practically urban women, all can take vaccine unless they're allergic or they're having very severe immunocompromise due to some very old or very serious complicated disease. So only those patients should not be taking vaccine. Now, why who all will be eligible? That means pregnant, lactating, menstruating, every single woman can take vaccine. If pregnant women want to take vaccine, right now the government is not allowing, but the NTAGI, which is the National Task Force of Vaccination, which it's trying to determine whether pregnant women can take vaccine, and they are on the path because world over all pregnant women are given vaccine. But here in India, it is still under the debate, and the government has not did it. So in practice, we are counseling all women that it is safe. There is no problem, no proven side effects. As of now, whatever studies are there, it is recommended to take it. It is unlikely to cause any abnormality in the fetus. So it is very safe for the mother, for the baby. But the problem is that as of now, if you register in the CoWIN and if you mention that you are pregnant, then possibly you will not be given a slot. So you can only take vaccine by probably going to private centers, declaring that you are pregnant and you understand that what are the risks and benefits, and that you are taking it at your own risk. That's the current standard. That's current recommendation, because this is what is allowed by the government. But possibly in coming weeks, pregnant women will be allowed onto the government website. Yeah, that means CoWIN also will allow registry for pregnant women, and they will stop asking you whether you're pregnant or not. So that will be a very big win for us as a gynecologist, because we want you protected even if you are pregnant. A lot of you are thinking that if I'm trying to conceive, or maybe I'm in my third week of periods and I don't know whether I'm already pregnant, please take your shot. There is no problem. It is absolutely safe to take your vaccine, provided you're not allergic to that. Yes, certainly we cannot be 100% sure after taking the vaccine about its efficacy, because there are so many variants and we do not know which vaccine will protect us against which variants. It is just like influenza vaccine, which changes every 6 months, wherein a new virus will come, a new mutated virus, and the old influenza vaccine becomes irrelevant. So every year you have to take influenza vaccine. So similarly, COVID is also happening this way, that you take vaccine and then you realize there are new variants coming in. So we don't know whether it will also become a similar norm, that there'll be new strains coming in, and then we need to vaccinate ourselves against the new strains again and again. So we are not sure. It's too early to say all that. But as of now, you can take the vaccine even if you're pregnant. If you're trying to have a baby also, you're not pregnant, you're taking fertility treatment, you are undergoing IVF, you're due for embryo transfer, you're taking other medications, you're taking other injections, all of you are fit to take vaccine. If you have any problems with thrombosis or something, then you must consult a hematologist before you're taking your vaccine. If you're already having COVID infection, then you should not be taking vaccine. If you had COVID infection, at least for 12 weeks, you should not be taking vaccine. That is another exclusion of the COVID vaccine. So practically, it is a killed vaccine to be taken by all. During menstruation, you can take. A lot of women have queries whether they can breastfeed the baby immediately after the vaccination. Yes, it is safe to breastfeed the baby. Then a lot of women are asking whether when they take the vaccine during pregnancy, will it protect the baby? So as of now, the studies are very limited, because there are very limited number of pregnant women have taken the vaccine. So the studies onto the babies born to vaccinated women is very few. So we will have to wait further to know. But like any other vaccine, when it is given to the mother, the antibodies are formed, and like any other virus or any other antibodies, they are expected to be transferred to the baby through the placenta and protect the baby. However, we do not still know the duration of efficacy, the efficacy against which strains, for how long this efficacy is going to last, what is the percentage of protection. So in this slide, we still need to take the universal precaution even after 2 doses of vaccination. Now, the difference in the vaccination doses, whether it is 4 weeks, 8 weeks, or 12 weeks, is governed by the government rules. And 8 to 12 weeks is mostly considered better, because they are giving rise to better antibody levels. However, it is still not certain. A lot of women have taken vaccine in 4 weeks interval, others have taken in 8 and 12 weeks interval, and we need to see who behaves better, because the disease is just 1.5 year old. And typically for these vaccines to have trial, most of the times the trial is required to be 5 to 10 years. So it's too short a period to say anything. But as of today, it is considered safe. So you get a chance, you take it. Obviously, you have to own up till the government gives permission. But till then, if you get a chance, please take your vaccine, because it is your right to protect yourself and the baby inside you. So thank you so much. It was nice speaking to you. If you have any questions, you can ask me now. So I have a question here, which I'm going, is vaccine safe in breastfeeding women? Yes, it is absolutely safe for lactating moms to take vaccine. There is no problem. It is safe before feeding. It is safe after feeding. And you can continue to feed your baby irrespective, even if you're having fever or some body ache, which we call myalgia, or some other mild symptoms, you can continue feeding the baby without any fear. Does COVID vaccine affect the pregnancy? So whatever the reports, as of now, they say it is unlikely to affect the mother to the baby. There are reports that about 0.6% of vaccinated people, they get the disease within few days after vaccination. So it is uncertain whether they got the disease before and at the time they tested negative and they took the vaccine, or it is actually a casual effect of the vaccine. It is not sure, but yes, vaccine doesn't affect the pregnancy. It is absolutely safe, and if you will make antibodies, it will transfer to the baby, and it's likely to protect the baby. So by taking vaccines, you're actually protecting two lives. So I believe that COVID vaccine is more cost effective in pregnancy than otherwise. The next question is, what should I do if I took the vaccine and did not know I was pregnant? It is absolutely safe to continue with your pregnancy. It is not considered teratogenic. It is not likely to cause any problem as of now. So many babies are born to the women who are vaccinated, and there is no worry. In fact, if you want to take your next dose during pregnancy, you should be taking it and not delaying it. But as of now, these studies, as of today, they recommend that they are absolutely safe to be taken and should be taken in pregnancy. And it's a good gift to your baby that you can give some immunity against the COVID virus, because recently we've had a couple of newborns who were COVID positive. So a more number of babies are getting infected. So it is important to protect you and your baby. It's absolutely essential. I'm 4 months pregnant, and can I go ahead and get the vaccination? Yes, absolutely. You can take your vaccination without any worry and fear. Yes, there's a possibility of some fever or some kind of body ache. So be prepared. A lot of my colleagues have taken paracetamol beforehand. This is prophylactic before they went on to take the vaccine. So if you intend to do that, it's absolutely fine. And later on, you can control your body ache and fever, if at all, with the same, and you can apply some ice pack at the vaccination site if you feel uncomfortable. But it's safe to be taken. So the government is not allowing, so you will have to take it at your own risk, but certainly you can take it. Uh, will the breastfeeding child get antibodies being developed by the mother's body? Well, it is still not certain. Most likely, no. Or maybe a very small quantity. It's unlike the pregnant women, who will transfer great amount of antibodies to their children, to the infant or the fetus, sorry, in utero. But the breastfeeding mothers, they might transfer some antibodies, but not much is known on this. So they're likely to transfer some amount of antibodies, but mostly the child will develop the antibodies now on its own exposure. And as we have all developed antibodies against various flu viruses because of our constant exposure from the childhood. Similarly, the children will also develop. The child, since it doesn't recognize most of the infections, it's less likely to have those kind of cytokine storms which can damage the child most. So what happens is they are likely to, even if they get COVID, they're likely to get mild infection, and most of these children will get cured very fast. So it's very unlikely that they will suffer. But if some kind of antibody, if it is going into the milk, it might help the baby, but as of now, it is not known. How soon after delivery can women get vaccinated? So as soon as you're comfortable that your body aches and pains have gone and you do not have fever, you can go and get vaccinated. I would suggest at least 10 days you need before you settle down, because there have been some cases of having bleeding, thrombotic events after vaccination. If you are not going out of the house, I would recommend wait for about 4 weeks and then take your vaccine. but certainly no clear time limit can be determined. But yes, you must recover from your delivery before you take the vaccine. Otherwise, there'll be total confusion whether the fever is because of complication of the delivery, like breast engorgement or some infection in the stitch site or some infection in the uterus, or it is because of the vaccination. There'll be a lot of confusion. So once you recover completely and you feel all right, then possibly get vaccinated. Thank you for joining today's webinar. See you next week with another topic. If you have any interesting topic to talk to, please share with me. I'll try to cover that. Thank you very much.